Thank you so much for tuning in on Facebook this week. My name's Kelly Sherman. I go by she, her pronouns, and I am the director of health and wellness for the Student Government Association. And we have some lovely special guests on this week. So I'd love you guys to introduce yourself.
Well, I'm Hannah. Sorry, I use she, her pronouns, and I'm a peer leader from the health center.
I'm Nick. I use he, him pronouns, and I am also a peer leader from the health center.
Awesome.
And hi, I'm Boris, and I'm the dean of the School of Public Health. I use he, his pronouns.
Awesome. Cool. Could you guys talk about what a peer leader is, just like to have that background information?
Yeah, definitely. So peer leaders are students who work for the health promotion and wellness services part of the health center. So we live on the ground floor. And so we basically earn credit for engaging the campus community about wellness, either mental health, sexual health, or substance use wellness. And we do a lot of outreach with presentations and tabling. And Nick and I loved that program so much that we stuck around for the second year. And so we help a lot with program planning at the health center.
That's so exciting. Awesome. Cool. Thank you everyone again for coming and tuning in this week. I love that we have the opportunity to talk to like some student leaders from the health center, just talking about like health promotion and everything during this time, during the coronavirus. And also it's midterm season. We have to think about that too. Something that you guys should keep in mind as watching this video, if you have any questions or anything, please feel free to drop them in the comments so we can get to them at the end. We're going to talk for a little bit just about resilience and student perspectives during this time, and also the Any Questions podcast that the peer leaders have produced. And then we'd love to address any questions that you might have about current events or anything that we've been talking about, which is really great. But I was just wondering, Hannah and Nick, are you guys a part of any other student organizations on campus? And how has that transition been to like online?
So I personally am not involved with any other organizations on campus. I am primarily health center oriented. I live and breathe the health center. It's all I do essentially. And that transition has been interesting. I mean, all of our classes are online now, but it's not too bad because I feel like a lot of the work that we can do can be done remotely. And I do have a job off campus, but they're not open, which is kind of a bummer.
And I am president of Sex Week at Maryland, which is all about sex positivity. And we actually just had our big week of events last week, and they were all online. We put them online. So we still have the resources up. And on our website, we talk about safer sex, birth control. So if you have any questions about those things, those are up. I'm also treasurer of HGAPS. It's a club where we edit Wikipedia pages to make them more psychologically accurate. So we're still doing that. And we just do Zoom calls every week and edit Wikipedia and have a lot of fun. So it's a good time.
That's so cool. And that's great that you guys are able to do different clubs remotely on campus too, off campus too. Dean Lushniak, how's the transition been to your at-home workspace?
Good. It continues to go well, but frankly, I'm getting tired of this. I really am. This week was for some reason a really tough week for me. I just was, kind of irritable with the idea that I'm stuck into this what's called a new normal, and I don't like it. Right. And it's not like that I don't like the people I'm hanging out with. It's my two daughters and my wife. We're doing well, and there's family time built in. But I think it's the whole idea of trying to be productive in this new world, right? And it's Zoom meeting to Zoom meeting to Zoom meeting, and there's no human connectivity on that, professional level. I'm also sort of filling in some time gaps occasionally, trying to learn a little bit more. And maybe I'm getting a little webinared out because obviously as a public health person, I'm spending a lot of time kind of learning more about what's the latest on COVID. So all in all, it's kind of been a weird week for me, and I think, our theme today really is the idea of resilience. And I think part of what I want to say is that we're kind of all in this together, whether you're a student at the University of Maryland, whether you're a faculty member, whether you're, in one of the leadership roles, whether you're a staff member, the College Park community, we're all scattered right now. And I would say that the majority, it's okay if you love this, but I would say the feedback I'm getting is the majority is really kind of not happy about where we're at. And part of it is the uncertainty. Part of it is the changing parameters. And so people are getting pissed off, right? I mean, there's the protests going on, open up society again and all that. So we're starting to see that phase of the struggle.
That's so true. Sorry, just going off on a tangent, but talking about like different protests and things, like, could you give your insight on like everything that's happening and if people should be going to the government, protesting, trying to get things to open, and just like shed light on both sides of that issue?
Sure. So, usually part of this show, we always do sort of the updates of what's been new and happening. Well, the numbers continue to grow. So I just sort of looked really quickly up in terms of numbers in the United States. We just broke 40,000 people who have died from coronavirus in the United States. That, to put that into perspective, is a real bad flu season, influenza season, right? Again, the danger here is I'm not comparing it to influenza, but also realize that those 40,000 deaths for influenza, if we have a real bad influenza season, is the whole influenza season and not just the last 3 months. So this is worse, right, from that perspective. Mm-hmm. Right now, we just broke 800,000 cases of COVID-19 in the United States. And once again, if you look at January as our start date, and this is now April, right? First case was January 21st, right? So you do the math. We're 4 months into this, and we have 800,000 cases. We talked about, my only point of reference with a pandemic like this in my career is a decade ago when we had the H1N1 swine flu. And then it was actually pretty bad, too. It wasn't a killer like this one is. But back then, it went from April until July before we hit 1 million cases. So we're kind of on that same theme, right? We're going to hit 1 million pretty quickly here in the United States. Globally, we're almost at 180,000 people who have died, right? Globally, with over 2.5 million people infected worldwide. So the weird thing is, once again, we're number one. Right. And it's not a pride factor for us to be number one. We're the epicenter of the epidemic right now. New things that have been going on this past week. Some interesting information that's been coming out, and this is from autopsy studies. To this point in time, we're thinking that the first death in the United States was on February 29th, right? That was sort of at that time, first case, January 21st, first U.S. death was February 29th. But in essence, some autopsy studies coming out from Southern California are showing that perhaps we actually had some deaths already, perhaps as early February, 3 to 4 weeks before our first attributed death. What does that mean? That means that probably the COVID-19 disease was already here way before we even thought it was here. Not that that's novel. We, in the world of public health, have thought that we're not doing really well on the testing front, and we continue to do abysmal on the testing front. And this is from a public health perspective. It's about testing. We have to get better at that. So that's point number one in terms of new things going on here. Testing still remains sort of the next factor. The other thing that you mentioned is the sense that people are getting upset. There are protests taking place at some state capitals. My sense is that people have the right to air their opinions, right? But it's not the right public health thing to be doing is to say, oh, it's somehow over. Oh, let's open up. Oh, this isn't helping. We're kind of stuck in a quandary here. And this happens in public health and preventive medicine a whole lot. And I'll be very precise with these words, right? When preventive medicine, that's what we're dealing with here, public health and prevention. When prevention works, nothing happens. Now notice that's a double entendre in terms of that, which means if it works, we're actually not oftentimes given credit for how it works. But also society doesn't, there's no, I keep saying, there's no fireworks that go off every time we prevent a disease because nobody even knew that we prevented it. It's a sort of it's a theoretical to some extent. We got to get better at that. And I think the people who are protesting, need to understand that when the tactics we've been using to this point in time have been working. But when people don't see or appreciate how it works, that's where they get really upset. said. So I think part of this idea of now some states saying, oh, it's time to open up, big mistake, right? I mean, I really think it's a big mistake. I understand the economy is an important part of what functions, but health and the economy are intimately tied, and we have to get better. So what's the progress ahead is that, I think it's premature to talk about how we're going to open things up like now, but we can talk about optimistically. We're going to open up things pretty quickly, right? Next few weeks or months, hopefully we'll start seeing a turnaround. But what do we need to see before that, right? We need about 14 days is sort of the thought on out on the street of 14 days of decreasing numbers of new cases of COVID-19, decreases numbers of people who are dying, decreasing numbers of people in the ICUs, people who are on ventilators, people in critical conditions. That's what we need, 14 days. And then we can start talking of how we do a phased reopening. It's not a switch. We're not going to say, okay, everybody back to normal, take off your mask, start, milling around. We have to do a phased reopening, and ultimately we have to be really observant, right, of what's going on in that phased reopening. The minute that we start seeing spikes, guess what? We're going to have to pull back. So I want our viewers and listeners to understand is that, there is a hope that things are going to get better, but we have to be very careful. And right now is the dangerous time. The dangerous time is all of a sudden you say, okay, well, it's not as bad as we thought it was going to be. Look at all these models. They're not happening. Let's just reopen society. We'll get slammed again. The last thing I want to bring up as a new thing, and this was just in the news in the last day or so, is the sense that the director of the Centers for Disease Control was talking about we have to brace ourselves for a second wave, and that wave may be occurring in fall, winter, which happens to coincide with our usual flu season. And so I think we have to be ready to kind of say is even though we may see some sort of diminishing of number of people who are affected, number of deaths, we're all happy about that we'll see a phased reopening of our society yet again. But we have to be ready that this thing may come back. And, to what extent will it come back? We won't have a vaccine ready, if we're lucky, until 2021. So the vaccine isn't the issue, which means we have to kind of get used to a sense of, making sure we're staying 6 feet apart from each other in the near future. The idea of mask wearing in public may be part of what we're all about. And certainly the issue of mass gatherings, right? The whole idea that, the sports things won't be around for a while, Terps football, we'll have to see what the fall brings us. All this is still kind of on the bubble right now.
Mm-hmm. Yeah, actually going off of the Maryland perspective for a second, we got an email this morning saying that summer session 1 is remote and online. So yeah, I think that's interesting just to think about. I wasn't even thinking of the fall or anything, but now that is a lot more in the conversation that we might have to phase out or have only half the campus come back or whatever it may be. But that is a really good conversation to have.
I think two things our students should have gotten this week. One was for the graduating seniors and those in graduate school programs that are finishing up their studies. Is the fact is that we have this alternative idea about commencement. And again, I'll be honest with you, none of us are happy about it, but we're trying to make this as special a commencement, a completion for all our students as possible. The other thing, as you mentioned, was the summer session decision, which came out this morning, I think, or might have been yesterday. Yeah. And the sense was that session 1 in summer session is going to be online. Summer session 2 will be, it's already statistically, most of the classes are online already, but we'll try to have some re-entry onto the school. Regarding the fall session, the provost is now setting up a committee to begin the discussions of what we're going to be doing for fall and what we need to do. So that will be looked at very closely. And you got to understand, a lot of this is, we talked about on the show before, is the sense is it's gazing into a crystal ball, right, from a public health perspective. But when I look in that crystal ball, as I keep saying, it's really murky. It's dark. It's not crystal at all because there's a lot of unknowns.
That's so true. I think just looking into that crystal ball and giving that perspective about the future, it is important to prepare for really the worst case scenario or whatever that may be. But also there are things that we have to do to get ourselves out of this mindset and get ourselves out of COVID and everything. So like, what have you guys been doing to combat kind of like burning out during this period, and just like staying super focused on COVID or just news in general, and how can that help you like going forward? That's Canna first.
Yeah, so I just kind of want to acknowledge it, like right off the bat, that everyone is really having a different experience right now. Like, yes, we're all experiencing COVID, but like everyone has different financial situations, different mental health situations. So I can't speak to everyone, but for myself, like I have been doing like a lot of reaching out to my support systems, like teachers, family, friends, even my therapist, making sure that I'm still having sessions online. I also have a cat, so I'm like snuggle with my cat all the time. And I really have to take things day by day and give myself permission to not be functioning the way I normally do, because this isn't pre-COVID. This is a new situation, and I'm just giving myself permission to experience that in whatever way I do.
Everyone's going to have good and bad days in this whole situation. It's weird. It's a different time. And it's okay. You know, it's okay that you're going to have good and bad days. But I think it's important to also have a way that you can get through those bad days. And that definitely comes in the form of self-care. Like Hannah mentioned, we each have our own individual ways of, taking care of ourselves mentally and emotionally and physically. And self-care, they're just activities that you can do that helps reduce that stress and anxiety. And it can be really anything you want, you know, like you can paint or read a book, like make a playlist on Spotify or something. And for me personally, my self-care routine looks a lot like, you know, trying to go outside as much as I can, being safe at the same time, but going outside as much as I can, going for a run or a walk or something like that.
Those are great tips. Dean Lushniak, what about you?
Well, the same thing. At first, I kind of want to bring up the issue that it's okay to feel sort of, you know, uncomfortable, right? I mean, you know, there's a discomfort. It's, you know, I hope everybody, you know, who's listening, and I hope that all of the three of you feel safe at home, right? You have a place to be. You know, first of all, is to have that empathy towards others who don't have what we have, right? And there is that sense that I think it's important at a time like this to reflect on how blessed we are with either the people who are around us, how blessed, Hannah, you are with the cat, with friends, with, you know, Nick, that you're able to get out, right? I mean, let's look at a positive side, but that's not a sort of delusional, you know, in terms of ignoring the facts. And the facts is that there are things that make us really sad, and it's okay, right, for us to get sad and perturbed, and whether it's what's going on in society, right, the inequities that we're seeing along racial lines of mortality. I mean, you know, you bring that as a public health issue. That's not something that we can be proud of, and it can really be disturbing. But begin thinking through how we can make the world a better place. You know, it's almost this kind of 150,000-mile view of saying, okay, what am I really learning at the same time? And sadness comes in various facets. It's for our own students. It's all the aspirations that you even had for the near term. And I'll reflect on what's going on in my house. I have a daughter who's a junior in college. I've talked about her on the show before. And one of the things she's gotten involved with is the last summer, and she was returning this summer, is to work at a summer camp for severely disabled kids on Long Island, New York, right? And she found it very difficult last year, right, to deal with this idea of young kids with disabilities, but found it very fruitful. And this year, she was coming back to a leadership position. She was looking forward to this thing. And yesterday got notified, just like she had been worried about for the longest time, the camp is not taking place this summer, right? The decision has been made. And the repercussions is not just on that personal level. It's not just that junior in college who said, oh, I was going to really sort of delve into this again and learn more about myself and about kids with disabilities. Now you begin looking at it even further, and you look at the disabled kid, right, who was looking forward to that camp, how their lives changed. And their parents, you know, who perhaps were looking for, a sense that their children were going to be in a safe environment, et cetera. And I use that example not to depress you, but the sense that that's the reality of our current situation, that it's not just about me as an individual. And sometimes what's helpful is when you realize that we're kind of, as I mentioned, we're all in this together. The repercussions of this are immense. And one way to dissuade this idea of self-pity in the midst of this is to look at how the world is dealing with this, right? And we have to look at the blessings that are in front of us, right? There's almost a positive click that needs to be going on. Much like Nick, I like getting out to the outdoors as much as I can, right? We have walking paths not too far away. And I think I've mentioned the idea that, one of the treats almost on a daily basis as I head to this viewpoint near a small lake here in Rockville, Maryland. And we've had eagles nesting there for the last 4 or 5 seasons. And every year at this time is, the time where mom's been nesting and a baby appears. And this is pretty far away. I sit there with my binoculars. I'm kind of a geek when it comes to this. I always say to my family, I leave with my big camera and my binoculars, and I turn to my wife and kids. So as we head off for our walks, and I say, hey, do I look like a tourist? And they go, no, you look like you blend in well. But, the fact is that there's 2 baby eagles in the nest, right? We saw the second one this past week, so there are 2. And, the sense is that that's kind of cool. In the midst of all this, somehow nature goes on. Let's also reflect that today is Earth Day, right? The 50th anniversary of Earth Day. And, I'm old enough to kind of recall, I was 10 years old or 11 years old when the first Earth Day happened. And I remember it started off very strangely because it's like, well, what do you mean we're honoring the Earth, right? I'm 11 years old. What are we doing? And I always described it. It was a bunch of people sitting in parks beating on drums, right? That was Earth Day. It was kind of this hippie movement of sorts. And what's great to see is after 50 years, I hope it's become part of our society, right? We're not doing very good at it, but it's part of our society to acknowledge that we live on this planet and this planet is near to us. And if there's nothing else that I've learned about the importance of our connectivity, and I think I might have described it before, is that we used to think everything was people-centric, right? Oh my God, this disease affects us. This is disease, COVID-19 came from the animal world. So we're connected with the animal world. And then we have the planetary health, right? And so if we look at health as a triangulation, it's not just about me. It's about me, the animal life on this planet, the planetary life of this planet, the whole biosystem, right? And I think that's an important part. So I kind of become more of, in my angst this week, I become more of a philosopher.
Yeah. You're like Thoreau, just off in the woods for 2 months. But yeah, that is really cool to talk about. And just like having those blissful moments and like blessings to see the eagles and different things in nature. And happy Earth Day, everyone. I completely forgot. Like, I know it's Earth Day, but I forgot to mention that. But that is really cool to have those moments. Nick and Hannah, have you guys like had any like random 2 seconds of hope moments that like just to like put a smile on your face, even though there's all this uncertainty going on?
Definitely when I'm outside in nature. I'm still actually on campus. So I go around and I skateboard. So I go and skate around campus a little bit. And a couple of days ago, it was like really nice out, really nice and sunny. And the wind was in my hair. It was lovely. And just those moments of just like, it's kind of empty campus, but campus is still, it's pretty in certain areas. And that was like a moment for me to like get all in my mind and in my head and just think about stuff and think like, yeah, this is kind of cool from that perspective.
That's awesome that you had that.
Yeah.
What about you, Hannah?
Yeah, for me, honestly, like I mentioned before, I have a cat and my family also has a dog, and I just try to just give them all the love that I can and just enjoy watching them do, mundane things like sniff things, like purr. It just makes me happy. And I'm just like, seeing other living things having a good time, and yeah, keeps me going.
That's so great.
I'm going to ask a dean question right now, Kelly, because the dean question to all our students out there is, how are things going on the studies front? What's going right? What's going wrong? So,
where to begin? I mean, each of us are going to have our own struggles. That's the biggest issue here. It's going to be unique for everyone. I've been doing okay. I have a sort of set structure, and I'm trying to keep organized. From what I've seen online and from my friends, I don't think that's going to be for everyone.
I'm kind of in a similar boat. Like, I'm trying to maintain structure as much as I can. the biggest issue for me is like focusing and also like sitting for like 10 hours at a time because I have to, work all day. Very difficult to do that. I think I really want to just appreciate all my professors for working so hard to adapt to this situation. And I definitely can see how hard it is on their end too to make something like this work. So I think we're all just trying our best.
Yeah, I completely agree. I think for me, it's like very hard to like sit for 10 hours at a time. And like, if I were at college, I would break up the day and, walk on McKeldin or whatever. But now I can't just do work at 2 a.m. Like I would wake up my entire house or whatever. Like, I just think that's like a big thing. And also, some of my professors are making an hour and 15-minute lectures into like an hour and 45-minute like videos. So it's just like very frustrating on that end because it's like I just don't have the time block to sit through and like watch that much, even though I do it on the weekend and it's fine. But from like a dean perspective, like has the School of Public Health had like meetings about talking about students' health during this time and just making sure that that's a priority from the professor lens?
Yeah, I think, we certainly have been discussing it almost on all our, 3 realms of the citizens of College Park, looking at the idea of, are we getting to our students, right, in terms of the idea of healthy lifestyles, mental and physical health. So we're attempting to do that. We have our advising structure, obviously, has gone online. I think the key role of advisors, being able to direct people to the mental health services from a distance if necessary, and even to the health unit, right, in terms of students who have concerns. So, part of it is it's no longer that face-to-face intervention, nor am I feeling confident, right? I mean, the problem is, we have obviously 2,400 undergraduates in the School of Public Health. We have 30,000 on campus, right? Another, or 1,000, 2,000 of graduate students in the School of Public Health and another 10,000 on the whole campus. And we don't have that personal interaction. So my fear always is I don't know what's going on with everybody, right? Nor do our professors have it, because what used to be, okay, I see that Charlie or Susan's not doing that well, let me talk with them. Now everything is hidden. And that's a fear factor for me. At the same time, the struggles that I was discussing and you were all discussing is taking place across the whole board. There are, our faculty and staff also have to be told that, what they're doing is different. What they're doing remains important. And I have to make sure that we have a connectivity, right? So, in our school, we've set up, and what's, from my former life in the Public Health Service Commission Corps is something called an incident command system. So I have, 6 leaders that I sit down with on a regular basis that I have connectivity, and they lead their sections, and we go into the departments to make sure. And one of the marching orders I've given is make sure you have connections with everybody. Make sure that there's nobody out there who feels disconnected, right? Who feels like nobody cares about them. It's obviously much more difficult to do with the student world. So I'm a little afraid that, that we're not, doing it fully. But we're trying.
Trying is a good first step, and recognizing the problem that we need to be having more solutions is a great first step as well. The peer leaders, you guys just recently dropped a podcast, which I know it wasn't in line with the coronavirus, but the timing is perfect for everything that you guys are discussing on your podcast. Could you talk about different things like that you guys talk about on your podcast and where we could find it?
Yeah. So the first episode that we released is actually about resilience, which is, I think, a pretty important topic at this point. We also released a podcast about consent communication, and then another one about kinky sex. And we're going to have one come out in May about the pleasure gap, and then we're going to have a bit of a break. And then in September, we'll have something about the minority and stress theory. And for right now, you can find that on the Health Center website. And you can also find it on Spotify if you look up our podcast title, which is Any Questions.
That's awesome. I listened to the resilience one yesterday, and I was inspired. I almost went for a run, but almost.
You thought about it.
Yeah, exactly. It made me, empowered to think about it. But then, but Hannah, could students like submit issues or anything that they would want to hear about, like anything on campus, like for this podcast?
Yeah, definitely. So we would recommend emailing health@umd.edu if you have any questions. But really, so far, what our podcasts have been based off of are questions that we do get from students when we're doing our outreach. So they really have been inspired by what we've noticed that people want to talk about or different passions that we have.
Mm-hmm. And how have your outreach methods shifted now that we're online?
That's a good question. Personally, we can't really do a lot of outreach right now. Mm-hmm. Like personally, me and Hannah, I don't think we can really do that. The health center is working on certain online outreach opportunities. We're doing a video series called I Flatten the Curve. So if you look at the health center Instagram, or if you go on YouTube, we've released 2 videos so far incorporating the peer leaders. So it's me, Hannah, and a couple other of our peers, talking about how we personally like flatten the curve. We provide some information about what flatten the curve means. And we have more videos coming out soon that will highlight a bunch of different peer cohorts in the health center. So that's like our main outreach that we can do, but we can't really do any of the same outreach that we've been doing in the past on campus.
But what's really cool is a lot of the things at the health center that normally are available online. So they do have like online meditation. We do our program Thriving Thursday online now. So that's just about health and wellness in general and how you can improve it. And we've also been releasing a lot of coronavirus specific self-care tips on our social media and things like that, and reposting other resources that we know are available, like the counseling center, or Haven has online substance use help and meetings. So there's a lot of stuff out there. It's just kind of shifted to this more, we're just like reposting things online and trying to engage online. So,
mm-hmm. And for these resources, are they like at a low cost, or are they free, like for students, or would they have to like pay for them?
So the meditation, Thriving Thursdays, the videos, they're all free. So awesome. Accessible by UMD students, which is really cool.
That's amazing.
Yeah.
I definitely would take advantage of that. And I would love to see like an online Wags for Wellness. I think that would be fun, just to bring as many dogs and as many good things into the light.
That would be cool.
Yeah, definitely. We actually just got a few questions submitted in real time, so we could answer those too. So the first question is, hi, Kelly, Stephen Johnson here, staff member at UMD 251 North. I wanted to know how you guys are helping students and non-students alike with those who have mental health issues. So with Dean Lushniak, would you like to start?
Well, again, it's sort of interesting. So I'll begin with what's going on at the School of Public Health, and in particular, looking at our community. So students and non-students certainly fall, into that wider community. And now that we're sort of dispersed all over, is Department of Family Science in particular. That's where our couples and family therapy program exists. It's interesting as a School of Public Health to first of all have this emphasis, not just on sort of the bigger public health issues, but specifically the mental health, public health issues that go on. Oftentimes that's a neglected component. So several things is the whole department under, as a team have really worked with the Prince George's County Health Department, with the State Health Department, to getting information out online, from everything about, how to deal with kids in the household while everything's going on, with bereavement as people are going through bad times and perhaps deaths of loved ones in the family, to sort of mental health coping strategies. So that's been one outreach. And again, it's difficult to do that one-on-one. So this is done through a population health or population-based method. But also what's interesting is that, we're the number one provider of couples and family therapy, mental health services for Prince George's County. As a educational aspect, we have a master's in family therapy program. And that program needs to be seeing clients, needs to be seeing patients, right, in that setting. So they've gone completely online and have revamped this personal therapy aspect that we conduct in the School of Public Health. Very few people know we have a clinic at the School of Public Health, right? The Center for Healthy Families. And that work continues because the needs have certainly gone up. And what's interesting is taking that from this personal approach to now making sure that those services are still being conducted at that population level and that our students are still learning, because don't forget that this is part of a educational process. And so our mentors, our faculty are also doing this with our students, right? There's a ability to evaluate the process. So that's but an example of what's been going on at the School of Public Health. I'll tell you that, we've been interacting a whole lot with Patty Perillo and the whole team at Student Affairs. Patty Perillo is brand new to the university. What a time to come as the Vice President for Student Affairs. But she actually is a graduate of our school from years gone by before we were a School of Public Health. And she really has a great public health approach to things. So it's been interesting that my discussions with her, which are happening very often, really prove the idea that she really has the welfare of the students in mind, and that includes the aspects of readjustment and mental health.
That's awesome to see that's like a mindset from the Division of Student Affairs as a whole too, just to have a public health lens on like different decisions and different risk communications and stuff. And Hannah and Nick, would you want to answer the question or talk about how peer leaders are helping those with mental health issues during this time?
Well, I know that the counseling center and our behavioral health unit at the health center have also switched to telehealth. So those are some really important things to know, that like the services aren't gone. In terms of peer leaders, it's a little more difficult just reaching out online. And yeah, Nick, do you have anything to add? I think it's really been an odd time and we're still trying to figure out what our place is in helping people's mental health right now.
Yeah, I think it's, again, really important to highlight the resources that have switched to an online format. Again, the counseling center and the behavioral unit and the health center. As peer leaders, I mean, we're trying our best with social media. I think that's our main way of reaching out to our peers. And we're doing that on the health center, like Instagram or Facebook. We have the podcast and we have the video series. So that's kind of like our main way just to reach out. It's not maybe directly telling you how to improve your mental health, but maybe hearing a voice from school, from your peers is a little helpful. We hope anyway.
Definitely. I think, whenever I hear like that, like one person like reaching out or something from my support system, I feel like that's like very helpful and inspiring. And also it's really great that the counseling center and the health center are still providing these services that students can use. I saw recently the counseling center put up a graphic about virtual mental health workshops. I thought that was such an interesting concept. And I think I'm going to see if I have the availability in my schedule to go to that. And maybe it can be something that we can continue even when we get back on campus. But that's really cool. Another question that someone submitted was a question for Dean Lushniak. This is from Jessica Crowder. She said that I've heard Governor Hogan state that we are in need for increased contact tracers. I was curious how current public health students may contribute. Should we contact our local health department to ask about how we can aid in this effort, or do you believe the School of Public Health may organize a student coalition to aid with remote contact tracing calls?
So that's a great question. And really sort of, if you look at the next strategy or the strategy that's going to be unfolding, is the importance of what? Testing, right? If we increase testing, that means we have to be able to follow up on that. Testing isn't just about, I got a positive, I got a negative. But to do this battle against COVID-19, first of all, we have to get into battle mode, right? That's the enemy here is COVID-19. let's be honest. And, all this politics aside, all this idea of protest aside, is we have to treat this as the enemy. So testing, testing, testing. The next T is the idea of tracing or tracking individuals who are positive, right? Treating those who have the disease, and then ultimately making sure that the tracking and tracing leads to something, which is either isolation or quarantine where necessary. For us to achieve our goal of putting this thing out of business is all that needs to unfold in the next few weeks to months. One of the major issues that have come up is obviously the testing issue. We don't have enough and it's not vibrant enough. So we need to be getting improved there. But also a next weakness is going to be the tracking issue, the tracing issue. And different groups have come up with the idea that we need 100,000 people nationwide, that we need thousands here in Maryland, that we need 300,000 people nationwide to help local and state health departments do the tracking and tracing. So my recommendation to our students are twofold. One of which we talked about the Medical Reserve Corps here in Maryland, and sign up. Google Maryland Reserve Corps Maryland. Or those of you who are in other states, look under that term, Medical Reserve Corps. It doesn't have to be medical, but it's voluntary work for those communities around us. That's one way of getting involved. We're still working with the state of Maryland. Obviously, that's the area that we're most attached with as a university sponsored by the state, to figure out the path ahead on the whole idea of tracking and tracers. And certainly we're looking at the ideas, how can we potentially incorporate our students into the tracking and tracing needs? So we're having those conversations with local and state health departments and with some state legislators as well within Maryland. So we realize that we have a potential force out there. And the force includes our students, our faculty and staff who can assist. So yeah, we're beginning those discussions to see how can we fulfill those roles. Also realize that this is another way of looking at the world of underemployment and unemployment. We have a lot of state employees right now, right, who are, working from home on administrative leave, and we do have a workforce there. I was reading recently about the Peace Corps workers who have been all brought in from international assignments and pretty much told your program's over. So we also have an obligation, not just for our students to be potentially involved in this, but obviously people whose lives have been changed because of this from an employment aspect. What we need is an organizational aspect from the state of Maryland, and that's why we're partnering with both the State Department of Health as well as locals to be able to organize. What do they need? And we can try to begin to help with those needs.
Awesome. And then also going off of helping the general public and helping educate people about what's going on, how do you think we could effectively educate younger children about what's happening right now?
Well, again, from our perspective, our Department of Family Studies has really looked at this in terms of how do you talk to kids about this? And there's a lot out there in terms of how do we incorporate an educational aspect into a child's life, who's also, life has been perturbed by this, right? They're not going to school, they're staying at home. Some jurisdictions have started online classes, right? Some are doing well at it, some are doing less well at it. But I think that's an important part of our society that we have to look at, which is, the kids out there, their lives have been changed. And so we're, within our family studies department, looking at the effect on children as well. And I know a lot of states and locals have not ignored that population.
That's good. And then we also have a question from Professor Stephen Thomas, just asking Hannah and Nick, how can we get more of our peers to participate in this forum or weekly chat or conversation just about health and the coronavirus during this time? It's your first day here. I'm already asking the hard question.
Yeah.
I mean, I know how we got involved, was just through people communicating across interdisciplinary communications between different organizations and groups within the Maryland campus. So for people to take advantage of those connections that they've had before or make new connections would be really important. Nick?
Yeah, I think just asking, communicating. I mean, like we've been saying, this is the time to be together. We're in this together, so this is the perfect time, I guess, to reach out.
Yeah, definitely. Yeah, I don't think there's any wrong answer to that. I actually saw one of my friends is a student in the School of Public Policy, and they're having a different discussion about just different guidelines for national borders or whatever for lockdowns, and if that's conducive during the coronavirus. And I thought it was really cool that different things are spreading across the different colleges because the coronavirus is an issue that encompasses everyone, not just health majors or whatever, which is really important to notice. Here. If anyone who's watching has any additional questions, definitely leave them in the comments so we can answer all of your questions. Should be great. But these were really great questions so far. Also in the comments, someone says that we should leave our stress-free COVID-19 playlist. Have you guys been listening to any songs or anything that has been keeping you stress-free?
Definitely
I made a whole playlist that I called Quarantine Vibes just to help myself. So it's just like they're just songs that I think are kind of funny and kind of relate to being inside and like alone. But I mean, it's just my own way of dealing with it.
I definitely can plug Sex Week. We have a playlist that we released last week and it's still up. So go check that out if you want some sensual songs to listen to. But for me, I've been really into Fiona Apple just released an album. And so I got excited about that because it's been a while. So that's just my personal fun thing.
That's awesome. Dean Lushniak, have you been listening to any great music recently?
Yeah, it's okay. So I'm a classic rock person, right? And so that's what the problem is it's really the music I kind of grew up with. And my wife and kids will always say is I've never evolved beyond that, right? I think REM is a brand new band. That's kind of the way I love REM and all that. But, it's interesting. I have my playlist, which is sort of a potpourri of things. And when I'm really into sort of the relaxation time, right, is I'll plug in and plug out and just listen. So I find myself, again, revelations about the Dean is I do have a hot tub in my backyard, right, in my patio. And oftentimes I'll find myself after a run, after a workout saying, I deserve this. So I'll, open it up. I'll press a button to turn the jets on. I get in. I put on a headset listening to music and it'll just make me go away, right? You've had a good workout. You're now taking care of your muscles and I'm in a whole nother land. So it's good to sort of disconnect. I do, however, want to bring up an issue, which is a public health issue. And this is specific to our listeners and everybody out there, is that what we know is the issue of use of alcohol and drugs are definitely going up in the midst of this crisis. So the whole idea of disconnecting with, music and your playlist and is a healthy approach. Beware of the unhealthy approaches, right? Alcohol use is definitely up. Strangely, liquor stores in many jurisdictions are considered essential services and remain open. The problem is increased use of this because people are finding that, okay, well, I'm sitting home. I don't have to drive. I don't have to go to work tomorrow. I don't have to go to school. Just be really wary of that being your disconnecting point. And I'll be honest with you. I see it in my own household, right? We love the glass of wine every so often. Well, the wine has been flowing a little bit more steadily here. And we need to be able to acknowledge that and to back off on it. Right? And it's not what we want people to be doing.
Building off of that too, this is a really difficult time for people who are in recovery or trying to be in recovery. And this is a huge trigger being stuck at home, being stressed all the time. So just, wanting to acknowledge that, and that there are like AA and NA meetings that are going on online. And that is something that you can access. Even like the Haven, that's right outside of College Park, is having resources that anyone can access. So there's still ways to connect and to, talk about substance use issues.
Could you talk about the Haven a little bit? I'm not sure if everyone listening knows what the Haven is.
Yeah, I don't personally know too much, but the health center often has a partnership with them. They're a recovery organization right off of campus. They currently are having online substance use help, so it's really great. They have a lot of really cool programs. I think they might also be involved in substance-free housing. I'm not quite sure, but it's just another resource for people who are dealing with substance use issues. And I think that's something that's so often not talked about, especially in a college setting, because a lot of things are more normalized. So, yeah.
Awesome. Thank you. I feel like even in this one segment, I feel like I've gotten so many more resources, whether it's the podcast, learning about the Haven, different things that are still happening on and off campus, which is really great. And thank you guys so much for taking your time out of your day to talk with us and talk to students and just really disconnect from the whole world. Like, you didn't get a notification during this call, and that's amazing. And I'm really proud that you guys are doing great work with the health center, with the podcast and everything. And just having student leaders like take the time out of their day to come and talk to other students. That's really important. And also, Dean Lushniak, thank you again so much for everything and your wisdom and just bringing in the light in the coronavirus in a less scary context. You're a lot more entertaining than reading an article, and also a lot more informative.
Well, thank you. Thank you, Nick and Hannah, for everything you do for our campus community and for being on today. Really, the message for the next week is, as the four of us have discussed, right? Midterms are taking place. To our students, your first job is being a student, right? And try to deal as much as you can with all the tests, with all the pressures that go on there, but continue learning. Learn in the context of this COVID-19 pandemic, right? Learn about it, learn about yourself, your family, the interactions. Decide on what approaches that you use to disconnect from the stressors around us, and use healthy approaches to be able to disconnect. And that's really kind of the word out on the street this week is, be taking care of yourself. Your physical and mental health is of prime importance. And as always, the optimist in public health is we're going to get through this, and we'll learn a lot about ourselves, about our world, right? So there is going to be a positive that comes out of a severe negative.
Definitely. Thank you guys so much for exhibiting TERP resilience and showing everyone about it. I hope you guys have a great rest of your week, and I'll talk to you soon.
Great.
Thank you so much.
Thank you.